Welcome everyone to another review class for our very uh, intelligent acupuncturist from the Philippines. Okay, so let's review the 8 principles of syndromes and their implications in TCM. So we will be doing a lot of pattern differentiation, which actually is the meat of our practice, no? And there are several ways on doing pattern differentiation, and one of which I think is the best, no? There's another one, the Zanfu pattern, but this one is the 8 principles. So pattern differentiation is a fundamental concept that focuses on identifying the unique manifestations of disease. Okay, so this is basically tailoring the your treatment based on what the patient actually has. So this will allow you to create tailored treatment plans that address specific imbalances within the body so that you will have improved overall health outcomes. So let's do an overview. Exterior syndrome. They affect the superficial portions of the
Kahoy kayo.
organs, involving symptoms like intolerance of cold, fever with aversion to cold. Okay. So severe chills. Fever and chills, they should be simultaneous. Okay. For you to say that this is exterior. Severe chills, mild fever, headache, nasal obstruction, and cough. The typical tongue appearance is a thin white coat. So this is normal. And the pulse is superficial because it is exterior. So what do we mean by superficial? Just like doing a butterfly palpation, you can already feel the pulse. Okay, what are intermediate syndromes? These occur when the anti-pathogenic qi, that is your immune system, is not sufficient to expel the pathogens. So there is alternating chills and fever, discomfort in the chest, vomiting, anorexia, bitter taste, dry throat, and a string thought pulse. So why is there bitter taste? Because when you have when you always get sick when you're exposed to an exterior syndrome, that means um, you did not really get well um, the last time. So that means the pathogen is just there. It stayed in your Shaoyang, your gallbladder, and their Sanjiao. So the pulse is string taut, no? Okay, so then we have the interior. This is easy because this resulted from an exterior syndrome, or this could be a direct attack on the Zanfu, just like cold. Like if you eat cold food, like ice cream, salads, or you're exposed to very cold environment, it easily affects your stomach. No, they present with fever without aversion to cold. So this time there is no more chills, and there or if there is chills, there it's quite minimal. Okay, and this time there is heat, and you do not expect the patient to be um, using too much clothes. In fact, he will try to not use a blanket at all. So there will be thirst. And when you look at the coating, it's still thin, but yellow. Okay. So distinguishes this from the thin white coating found in exterior syndrome. Interior syndrome, thin but yellow tongue coating. And the pulse is still superficial and rapid because of the heat. Now, what are cold syndromes? This is because you were exposed to cold or you have yang deficiency. Okay, so you have aversion to cold, you prefer warmth, and you have pallor and cold limbs. The tongue, of course, will look pale, white, moist coat. Remember, when you have a very moist, very wet coat, that signifies cold. And the pulse is slow and tense or tight. Okay. Hot syndromes. This is due to invasion of heat coming from outside, or when you have yin deficiency. There will be fever, thirst for cold drinks. You always look for anything cold. Okay. Irritability. In fact, if you Okay. this will really guide you in the diagnosis. If the patient really loves cold drinks, then that is a given, no? Irritability, yellow, scanty urine. The tongue is red, yellow, dry coat because there's heat, and the pulse is rapid. Now, let's talk about yin deficiency. When you look at the tongue, there is no coating, okay? This results from kidney yin deficiency. Remember, the kidney yin is the root of yin of the body, of the organs, no? So there will be mental restlessness, insomnia. Why? Because when you talk about kidney, there is almost always an effect on the heart because if you remember, the heart and the kidneys they are like fire and water. It's a classic example of the yin and yang. So if you have very yin deficient kidney, so the 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 fire of the heart will be um, unmitigated. So there will be a lot of insomnia, irritability, restlessness, and malar flush. Malar flush is very pathognomonic. You will see that on the cheek, no? Affected organs typically include, so take note of this, heart, liver, and lungs. Okay? So again, this is because of a very weak kidney. Okay? So this affects your heart, liver, and lungs. Okay, this one is another very common situation that you see in the clinic. Heat above, cold below. Okay, above means you have thirst, irritability, and sour regurgitation. Heat sensations, they come from the chest. Cold symptoms below, like abdominal pain that is relieved by warmth. So that's cold below. Cold exterior transforming into heat in the interior. So everything will transform into heat when it goes inside, no? So cold exterior transforming into heat. There will be fever, aversion to cold, headache, stiff neck. Okay? As the condition evolves, cold signs subside while fever and other heat symptoms remain. So what are the characteristics of exterior syndromes? They involve the superficial portions of meridians and collaterals, primarily affecting the skin. So when you touch their skin, it's a little bit hot, no? The hair and the muscles. So they have these flu-like symptoms, diba? These syndromes, because of this results from your intolerance to cold. So there will be fever and aversion to cold environments. So the patient can experience severe chills, mild fever. They're always together. In fact, they're simultaneous, no? Okay. Accompanying symptoms such as headache, body aches, nasal obstruction, and cough. And notably, these patients, they typically do not sweat or feel thirsty. Okay. Now, what about intermediate syndromes? Okay, as we mentioned earlier, this is due to the fact that the anti-pathogenic qi is lacking, is insufficient. No, the body's immune system is unable to eliminate the invading pathogen. Okay, so there will be alternating. So the term is alternating chills and fever. Okay, so this indicates a struggle within the body's defenses. Symptoms, they have discomfort and fullness in the chest, along with vomiting and anorexia. Bitter taste in the mouth, that's very, very young, that's very, very gallbladder, okay? Gallbladder, and a dry, but because too much young will give you bitter taste, no? And a dry throat. This reflects the impact of the syndrome on the digestive system, of course. When you look at the tongue, the pulse is wiry or string taut. Remember, another name for wiry is string taut pulse. It's like the the hardness of the guitar string or the violin string. Okay, this indicates this thing, no? The tongue may appear normal or show mild changes because there is internal struggle without clear acute symptoms. So that's intermediate. So it's gallbladder Santiao. Next, let's go to interior syndromes. They arise when a pathogen comes from the exterior or they directly attack your organs. So this can happen because of direct invasion, emotional disturbances. Kaya do not be stressed, especially when you travel, you will really get sick. Proper diet or excessive stress, no? Key symptoms of interior syndrome. Okay, there will be no chill, there will be fever, and indicating a strong heat presence. Wait lang, medyo na-distract ako. Ano kaya yon, Jack Russell? Okay. Um, Heightened thirst, sense of agitation. Okay, so they reflect internal imbalance. Okay, so this is coming, interior syndromes, they come from outside. Okay. Okay, when you look at the tongue, because there's heat, thin yellow coating, the pulse superficial and rapid, indicating the body's response to the internal disturbance. So this is about ano ha, this is interior syndrome. That means something provoked it. It's different when you have a deficiency condition like yin yeah, chronic conditions. The pulses are very deep. Let's go to cold syndromes. Cold syndromes due to prolonged exposure to cold environments or deficiency in yang energy. So there is a struggle to maintain warmth and balance, leading to symptoms, specific symptoms. So what are the symptoms? Aversion to cold, and they always prefer warmth. Okay, they have tastelessness, they have cold limbs, indicating impaired circulation and energy flow. So when you look at the tongue would be pale, white, moist coating, which indicates excess cold. Pulse, of course, is slow and tense or tight, reflecting the body's response to cold conditions. So what are symptoms and characteristics of hot syndrome? So we're done with cold. Hot syndromes caused by, again, invasion of exogenous heat, or when you have yin deficiency. Okay? This will lead to various symptoms that will reflect the struggle to maintain the body's homeostasis. So there will be fever. They love cold drinks. They're very irritable. They're constipated. So this indicate excess of heat within the body that disrupts normal function. So when you look at the tongue, what do you think will be the color of the tongue? Red, no? Then the coating will be yellow and dry, indicating heat accumulation. Pulse is rapid. That means there is excessive yang or heat condition in the body. Now, let's talk about yin deficiency. What causes yin deficiency? Again, as we mentioned earlier, this is because of a kidney yin deficiency. What causes it? You forgot that you were just human. You are overworked. You work too hard. You make use of your brain a lot. You study a lot. Okay, this serves as the foundation for all yin in the body. So if something goes wrong with the kidney yin, the rest will follow. Okay. Common symptoms, they have mental restlessness and insomnia. What causes this? The empty heat, no? The heat generated by the yin deficiency. There will also be irritability and malar flush, highlighting emotional and physical disturbances. So what are the organs that are affected? Number one, heart, liver, and lungs. Okay. So if you don't see any coating at all, and from the history of the patient, you were able to extract that this patient is a hard worker. Usually, successful people, they really work hard. So, heart, liver, and lungs. Okay, this can disrupt their normal functioning. Okay, heat above, cold below. Okay, so there's a combination of symptoms. And so there is imbalance between the upper and the lower body. So symptom above, thirst, irritability, and also regurgitation, sour regurgitation, no? and also that reflects digestion problems and the chi flow. Okay, so the heat above characteristics, there is heat sensation in the chest, they feel hot, and there will be mouth ulcers due to the high levels of internal heat. Okay, now cold below, there will be abdominal pain that can only be relieved by warmth. So you think of cold, okay? So this contrast between heat above and cold below illustrates the complexity of the body's energy dynamics and the need for targeted treatment strategies. Now, what about cold exterior that transforms into heat in the interior? This signifies progression of the illness, where initially the symptoms are cold or cold, yeah, and then it becomes heat. Okay, so that means there is deeper invasion now. That means the pathogen has gone deeper, and so this will alter the body's response. So, what are symptoms of internal heat? They have fever that is persistent, of course, because of the heat, increasing irritability and thirst because the body copes with the internal heat, no? That develops after. So even if you had cold before, like it's exposed to, they say you went to Europe and it was very cold. So if you happen to have a very weak immune system, so you will also have heat inside, no? So understanding this transition is crucial for effective treatment strategies. Okay? So remember, yin doesn't remain yin forever. It should become yang, that they are transformed. Okay? Now, what are the symptoms of heat transforming to cold? There is sudden onset of cold limbs. All of a sudden, you felt, why are your limbs cold? Okay? Indicating a shift in the body's energy balance. Okay, so actually the limbs, the arms are cold, but the internally it's hot. So when you feel the pulse, because the pulse is located outside, no, so limbs, deep and slow, so which reflects underlying deficiency or stagnation of vital energy. So what are the key symptoms of true heat? Okay, there is such thing as true heat, false cold. Okay, in these patients, the limbs are cold. Even if the limbs are cold, they always look for something cold. So that's true heat, false cold. So true heat meaning they really feel hot. That's the real thing. And yeah, because they like cold drinks, they prefer cold drinks. But when you feel their limbs, why are the limbs cold? And yet the patient prefers. So this true heat, false cold. Okay, so there is an explanation to this. Despite feeling cold, they have aversion to heat, characterized by burning sensation in the chest and abdomen. So anything that's true is the one at the core. Okay. Okay. What are the contradictory symptoms of true cold, false heat? This time we have true cold, false heat. Okay. The patient experiences a sensation of heat internally while the patient exhibits signs of cold externally. So, the presence of feverishness and a flushed face, you would think there is heat. However, even if the patient looks feverish, he would always cover himself, no? And he would prefer warm liquids, okay? And this indicate external cold. So this inconsistency, so there is such thing, true cold, false heat. Now let's go back to yin deficiency. Now yin deficiency, that means there is pallor. However, the cheeks are red, no? Pale complexion accompanied by flushed cheeks. So that means there is an imbalance in the body's cooling and nourishing aspects because the yin is deficient. So there is persistent low-grade fever, particularly noticeable in the afternoons or evenings. They experience night sweats, which will often disrupt sleep. So these are the patients who keep on waking up at night, no? So there, of course, if they lack sleep, they will have fatigue and weakness. Other symptoms, dry stools, because they have insufficient fluids. Remember, yin deficiency. And emaciation because they lack nourishment. So this is the situation where you need to really think of giving nourishing foods, not only acupuncture. Now let's go to qi deficiency. The face is pale, the voice is weak. Okay? Because they lack energy. Weak voice, because the body's energy supports vocal strength. So since they lack energy, so they have weak voice. Slight sweating, because we all know that the pores are open because they are not, um, they have a very weak Wei Qi because of the lung, weak lung. Okay? Tiredness, okay? And notable lack of appetite. They have diminished energy reserves, making it difficult to engage in regular activities or maintain a healthy diet. Okay. Empty pulse. This is also called weak pulse, no, deficient pulse. So when you say empty, it doesn't mean that the patient doesn't have any. Okay, it just lacks substance or vitality in the body's energy systems. So if the pulse is very empty, okay, almost non-existent. It is a key diagnostic indicator for practitioners evaluating a patient's overall health and energy levels. So if the pulse is empty, think of qi deficiency. Now let's go to yang deficiency. Actually, qi deficiency and yang deficiency are almost alike. With yang deficiency, there is cold symptoms whereas qi deficiency, there is none. So for yang deficiency, just have to add cold feeling, cold limbs, okay? So that means yang deficiency is an aggravation of qi deficiency. So yang deficiency, bright, pale face, because there is lack of warmth and energy. They often feel chilly and they experience cold limbs because the yang is unable to provide sufficient warmth. Okay? Remember, this is already yang deficiency. Okay? There will be spontaneous sweating, even in the absence of exertion. Okay? Sometimes they just stand up there and they start sweating, especially when they go outside. So there is compromised ability to regulate body temperature. They will have loose stools and frequent pale urine. Okay? Okay. Individuals with yang deficiency, they show signs of profound fatigue and general lack of vitality. The body's inability to maintain warmth leads to feelings of cold that permeate everyday life. No? So this can affect the quality of life. Okay? They don't become alert mentally. So that's why if you cannot remember all of our lectures, probably you already have yang deficiency. Okay? Regular monitoring and holistic approaches to restore yang are essential for recovery. I would suggest that you do 14, okay, to put more heat, okay? Or you do moxa of your do 4 and your bladder 23. Now let's go to blood deficiency. Blood deficiency is an earlier version of yin deficiency. Remember, blood falls under the realm of yin. So, blood deficiency, you have a pale but dull complexion because there is inadequate blood nourishment to the body. There is insomnia, so they will always have difficulty sleeping or start to sleep. This is linked to a lack of blood supporting the heart's function. And also they have poor memory, long-term memory, okay? And cognitive, sometimes you may not remember the names of your very good friends anymore, okay, after 10 years. So this is because of insufficient blood supply to the brain. And it is very important to be able to do something about your blood deficiency because you wouldn't want to see yourself suffering from dementia in the future. Okay, so we need to really, really address this issue. So you need to know what is blood deficiency. Common emotional and psychological effects, depression and anxiety, often exacerbated by lack of blood nourishing the heart and liver. And you know how the liver and the heart are related, right? The deficiency can lead to numbness and blurred vision if the liver is affected, illustrating the broad impact of blood health on overall well-being. So the affected organs when you have blood deficiency: heart, spleen, and liver. Okay, the heart is crucial for emotional well-being, spleen for blood production and nourishment, liver for storage and regulation of blood. So this shows us that these three organs are really interconnected to maintain overall health. So spleen, liver, and heart. Okay. Um, Next, yin collapse. This is worse than yin deficiency. Okay. So the symptoms, there is significant perspiration that is sticky in nature and a sensation of heat in the limbs because they have no yin anymore. The yin has collapsed. Individuals will have dry mouth, strong desire to drink cold beverages, along with symptoms of constipation. Okay, if we have yin collapse, we also have yang collapse. Okay, when you have collapse of yang, you have profuse perspiration that is oily. Okay, so if you sweat profusely, and then you notice, oh, it's a bit oily. So you experience a sensation of chilliness. And since you lack yang, there will be very cold limbs because there is severe deficiency in yang energy. Now, let's go to acquired chi. What are the components? If you were not so lucky to be born with a very healthy constitution, it now all depends on how you live your life, right? So we have what we call the Ta Chi or the Qing Chi. This is the essential air energy that is absorbed through respiration, playing a vital role in sustaining life and promoting health. It is a crucial component of. That is why even if you eat the right food, you have a very, uh, I would say, very healthy lifestyle. But if you happen to live in an environment that's very polluted, I think it's also going to give you a problem. Chi or food or drink chi. This is derived from nutrients and fluids ingested through foods and beverages. It is transformed in the digestive system into energy that nourishes the body and supports various physiological processes. Then we have the so-called yang chi or the source chi. This is the innate energy that you inherit from your parents. So you just have to, you only have your parents to blame for it. So this is the foundation of all chi in the body, and this is essential for growth, development, and for overall vitality. That is why we need to really expand our practice to include those who want to get pregnant. So even if they get pregnant, you have to make sure that they have very good Tsang Chi or upright Chi, so that the baby will not be unfortunate to inherit all these bad things. No? So the Chi mechanism, we have four directions of Chi movement. The Chi mechanism is fundamental to the flow and function of energy within the body. So what are the four movements, four directions? We have the upward movement to aid in lifting the yang and promote vitality. Then if there's an upward, we also have an outward movement to disperse and expel excess heat outward. And then we have the downward movement for elimination of waste and stagnant energy. Then the inward movement to nourish the organs and to support internal function. So it's upward, outward, downward, and inward. Okay, now let's go to body fluids as yin qi. Okay, so what is yin qi? Body fluid is a more turbid form of yin qi, which is essential to maintain bodily functions and nourishment. It plays a crucial role in the balance and distribution of fluids within the body, influenced by the clear yang qi. So if you have a turbid yang yin qi, we also have a clear yang qi. Yin qi nourishes the organs and tissues, while the circulation of body fluid is primarily managed by the lungs, kidneys, and spleen. Proper balance of these fluids is essential for health and vitality. Now let's talk about body fluid circulation. Body fluids, they play a vital role in maintaining homeostasis and transporting nutrients. Okay, that's why do not forget the Santiao Bakshu, no, bladder 22. The Santiao channel is responsible for circulation of body fluids, ensuring, so making sure that they reach all necessary organs and tissues for proper function. Okay, the Santiao channel, often referred to as the triple warmer. Actually, it has many names, no? Triple extinguisher, triple burner. Okay, ano pa? Yeah. It regulates the transformation and distribution of body fluids. And this will work closely with the kidney, spleen, and lung. No? So in my practice, I never forget the bladder 22. Okay? So kidney, spleen, and lung. The direction of circulation for body fluids in the Santiao channel is opposite to that of your Yang Qi, which emphasizes the complex interplay between the two forms of Qi in maintaining health. So what are the organs responsible for body fluid metabolism? Let's start with the lung. The lung will regulate the distribution and transformation of the body fluids. It helps to disperse fluids throughout the body, ensuring proper hydration of tissues. Next, the kidneys, okay? Because the kidneys, they filter blood, regulate electrolyte balance, and maintain fluid homeostasis. It is responsible for excretion of waste products and retention of necessary fluids. The spleen, it's very important for the production and transformation of body fluids because they convert food and drink into usable energy and fluids. It also maintains the balance of fluids and prevents dampness and accumulation. So what are the organs responsible this time for blood metabolism? The heart is number one. It makes sure that the oxygen and nutrients are delivered throughout the body. It plays a critical role in maintaining overall vitality and health. No, remember the heart is the emperor, right? The liver to regulate blood volume and storage. It also plays a vital role in blood detoxification and ensure that the flow of qi and blood is smooth in the body. Then we have the Chong channel. It's the penetrating vessel. No, this is called the sea of blood. This is pivotal in connecting the organs involved in blood metabolism and ensuring proper distribution and nourishment throughout the body. Now let's talk about the formation of blood. How do we form blood? It's a combination. It is formed through combination of your Yin Qi and your Qing Qi, which is essential for nourishing the body. Yin Qi will represent the nourishing aspect, while Qing Qi is derived from the air and food consumed, contributing to the overall vitality and quality of the blood. Okay, the primary confirming symptom for all exterior syndromes. So be thankful if it is only an exterior syndrome, not interior. Is chills, indicating the body's struggle against external pathogens. Okay? This is often accompanied by other signs that reflect the body's reaction to cold invasion. So pattern differentiation is crucial because it guides us in the diagnosis and treatment strategies. The 8 principles provide a framework for understanding various syndromes and their manifestations, ultimately aiding practitioners in delivering personalized care. Thank you for listening. Okay.